Have you been struggling with your weight for quite some time and now you're starting to think that you should take one of these weight loss medicines, but you're a little worried, you're not quite sure? Well, if you answered yes, you're going to want to listen to this video because I'm going to talk about 5 points to consider where the new popular weight loss drugs, I'm talking Ozempic, Wegovy, 5 things to consider where those drugs are concerned. Now, I should say first that you should not do anything I say in this video or anywhere else. You need to talk to your own doctor and get personalized recommendations from your own healthcare provider, okay? Now, for those of you meeting me for the first time, I'm Dr. Amina, Goodwin, a physician and a health coach, and I help overweight people with blood sugar problems fix those problems without having to take more medicine. All right, weight loss drug therapy. We're talking Ozempic, we're talking Wegovy, and what exactly are these medicines? These medicines are, well, they're called GLP-1 agonists. Essentially, they are medications that increase the concentration of a specific hormone in the body. Now, this hormone is found naturally in the body. It's an incretin type hormone. And this is a hormone that is produced in response to eating food, taking food into the mouth. The production is increased by the stomach. And this hormone does 4 things. One is that it tells the pancreas to make more, or rather put out more insulin in response to the food that you're eating in preparation for the expected increase in blood sugar that will come from that food, right? Fortunately, this increase in insulin that is caused by this medicine is short-lived, so it should not contribute to the actual underlying problem of type 2 diabetes, which is excess insulin, which causes insulin resistance. But anyway, this increase in insulin from the drug is short-lived. It's only in response to food. That's the first thing that these drugs do. The second thing is that these drugs decrease the hormone that acts in the opposite way to insulin. So whereas insulin is supposed to drop or bring blood sugar levels down, there's another hormone called glucagon, which carries blood sugar levels up when they start dipping. Sometimes people can have an abnormally high glucagon level, response, where it's telling the blood sugar to go up when you really want it down. So these incretin type drugs drop glucagon, so you're not having increased blood sugar levels at the same time, okay? Third thing these medications do is that they actually decrease the activity of decrease the muscles of the stomach. So they slow down the contraction of the stomach so that it empties out much slower. Because it's emptying out much slower, it means that you're going to feel full quicker, okay? And probably feel full for longer because the food is staying in the stomach for a longer time. So that's the third action of these medicines. It decreases the emptying of the stomach. And then the fourth action is that it decreases your appetite. So separate from the fact that your stomach is full and so you don't really feel like eating more, it actually acts on the brain to tell you to stop eating, that you don't want any food. So it suppresses your appetite. Some people feel as if they just can't control themselves in terms of how much they're eating. These drugs help to decrease the amount of food you're eating. So for diabetes, it's the first 2 actions, the fact that it increases insulin in response to food and decreases glucagon. That is the diabetes effect. And then the effect on people who are not diagnosed with diabetes but have problems with weight and eating and so on is the effect of slowing down the emptying of the stomach and decreasing the appetite, so that overall people would be consuming fewer calories. Now, what could be some problems related to these effects of the drug? Well, one, and maybe the one that concerns me, I guess they're all concerning, but one of the problems is the slowing of the stomach emptying, right? Because there's a problem that many diabetics face after having diabetes for a long time. It's called gastroparesis. And in this condition, because long-standing diabetes damages the nerves, it damages the nerves everywhere, hands, feet, everywhere. It also damages the nerves of the stomach. So people who have had diabetes for a long time, stomach nerves are damaged, so their stomach actually does not empty out. It's sluggish. And so these people have lots of problems with vomiting and bloating and belching and nausea and so on. And some of them actually start losing weight because they just can't eat anything. Their stomach does not push food out. Now, if this is a problem related to diabetes itself, if a diabetic has this problem, gastroparesis, it might not be in the advanced stages, but it might be in the early stages. taking one of these injectable medicines, semaglutide, let's just call the drug name semaglutide, taking semaglutide can actually aggravate the problem of gastroparesis that somebody might have. And so somebody like this would have even worse nausea, vomiting, belching, belly pain, and just total intolerance of food. Okay, now in generally trying to eat healthy and so on, having unprocessed food is one of the things that somebody who's trying to eat healthy should do. Unprocessed foods are more bulky, so there's more fiber and just generally more bulk compared to refined food, which doesn't have all this roughage in it, and so that would be, you know, easier on the stomach. But if you're trying to eat healthy at the same time you're taking a medicine that slows emptying of your stomach, you can imagine how really uncomfortable it gets with all that bulky fiber in your stomach, and how that might really decrease your tolerance of any significant amount of food. Okay, so worsening of online gastroparesis is one of the concerns with these medicines, and if not gastroparesis, just generally this discomfort related to decrease in the stomach emptying, to the point where somebody could potentially get malnourished, right? But we're going to talk about that later, right? Second problem. Oh, by the way, one thing I should say too with this gastroparesis is that a lot of people who have diabetes, they have other medical problems, and actually it means that you're taking many other medications. Now, medications are absorbed usually in the small intestine. If you're having a medicine that's slowing the emptying of your stomach, it means that medicines that you might need for other effects might be staying in your stomach, and you might not be getting the effects of these medicines. Okay, so that's something to consider as well, where you know, it might be decreasing the effect of other medicines, and your doctor might be thinking, oh well, maybe we need to increase the dose because you know, your blood pressure is still high or your cholesterol is still high, when the fact is that the medicine is just not getting down in time to have the effect that it needs to have. Okay, second problem with these medicines, obviously, and these problems are in no order of importance, but second problem, which would be even bigger for people in maybe lesser developed countries, is the cost. These medicines are not cheap. It's like over $1,000 a month, US dollars, okay? And so that, you might say, okay, well, I can afford it, but for how long can you afford this? These medicines are promoted to be taken for the rest of your life. I like the idea of medicines as a bridge until your lifestyle and diet effects take effect. But if you're going to take a medicine like this for the rest of your life, it's going to get expensive very quickly. Some of you might say, well, I have insurance is going to pay for it, but you will still have a copay in many cases. And what is happening with a lot of the insurance companies is that they're finding it very expensive to continue to pay for this medicine for so many of their members. And so a lot of people are finding themselves being dropped by health plans. So they would have been covered for a year or 2 years or so, and then suddenly they're dropped. The health plan is no longer covering them. Many people are finding that the rules are changing on them. So whereas they were being covered because their A1C was a certain level, the rule is changing, and now because they improved and the A1C actually got better, which is what we want, then the drug plan is, the health plan is dropping them, you know. But the fact is, in many of the cases, the medicine got them to that level. So to drop them suddenly means that they could potentially get worse again. And then you have this yo-yo effect where maybe you're back and forth on the medicine, and that's just not good for the body, which really likes balance. Okay, so the cost is an issue, and copays, you know, for those who have insurance, the copays could increase with time. Okay. The third issue that I want to mention with these injectable weight loss drugs is the fact that there are drug interactions. So again, a lot of people who are taking these medicines are taking other medicines, and the commonest drug interaction is with interaction with other diabetes medicines. So if you're taking it with any other medicine that could lower your blood sugar level, it means that you can have an abnormal decrease in your blood sugar level, which can actually be dangerous, where you go too low and can even pass out. So that's really something to consider. Abnormally low or dangerously low blood sugar levels because of interactions with other medications that you might be taking, particularly for diabetes, right? The fourth concern with these drugs, and it's one that's coming out more, I saw it, actually, I heard about it before, and then I saw an article where a lawyer, there's a class action lawsuit in Louisiana because of the increase depression and even suicidal thoughts in people taking these medications. And it is really not clear why this medicine is causing people to be suicidal or just outright depressed. But one of the reasons that I came across is the fact that Eating is one of the simple pleasures of life. Like, we do derive pleasure from eating, not necessarily dessert, but just eating in general. And so if you're taking away somebody's appetite, you're taking away that simple pleasure of life. And you know, the gut, right? We have a nervous system within the gut. And so it's connected with the brain. People talk about gut-brain axis, but suffice it to say, if you take away that pleasure, it could possibly be that you're taking away overall feel-good chemicals and just the overall sense of well-being. And so not being able to eat, people can potentially get depressed. And maybe, you know, if depression gets so severe, they can get suicidal. It's not clear what's going on. I do know that when we have patients in the hospital who have to be without food for whatever, usually it's a surgical problem. They had surgery on their intestines and they have to be without food for prolonged periods, sometimes for a period of months. And sometimes these people get very, very sad about not being able to eat. They dream about food. They dream about some of the things that they like, and they are very, very unhappy about not being able to eat. So it's possible that taking away somebody's drive, taking away somebody's appetite, taking away that simple pleasure of life can affect the mood overall and actually result in significant depression to the point where somebody's suicidal. So something to worry about. And maybe it's not common, but the fact is you don't want to be the one that, you know, almost, you know, took your life, okay? And then the fifth and final point I wanted to mention, which I alluded to earlier, is this issue of malnutrition. Now, because this medicine decreases the emptying of the stomach, and there's that nausea and vomiting and bad feeling, some people are just not eating enough. Now, again, because of the fact that bulkier food might aggravate these problems, people might be resorting to shakes, diet shakes, and just simple non-nutritious foods. If you're not eating nutritious foods, that risk of malnutrition is going to be quite high in these cases. And there have been the talks of the Ozempic face, and some people are quite wasted in the face and their muscles and so on. And it could possibly be that in losing weight, you lose muscle mass as well, because you did not focus on the calories that you're having being totally nutritious calories. So very, very cautious. And that's why this medicine can be a bit of a trap, because if you're not learning first how to eat in a nutritious way, right, taking a medicine just to decrease your appetite and decrease the amount of calories you're eating overall can make you worse off than if you just continue to eat normally, but just change the quality of the calories that you are eating, okay? So these are some points to consider when thinking about taking the medicines, right? The weight loss medicines, the new weight loss medicines, semaglutide being the common one. Just to go over them again quickly, number one is that you can have worsening of a condition called gastroparesis, where you're just not emptying out your stomach and feeling very sick as a result. Number two, cost is going to be a problem, a worsening problem. Three, there is the potential for drug interactions. You can have interactions without medications that you're taking. Four, you can get depressed possibly and even suicidal, God forbid. And then five, the chance of malnutrition is a real chance, and you have to be very, very cautious and particular with the food that you're eating. So I hope you found this helpful for those of you who are really considering taking these medicines, but you're not sure. Some people are scared of taking the medicines because there has, you know, when it bleeds, it leads. So obviously the bad side effects have been mentioned a lot. Personally, I think for some people who really have a bad problem with weight and diabetes especially, you can think of the medicine, intend to use the medicine as a bridge until the diet and lifestyle effects or changes that you start take effect, and then you can hopefully wean yourself off this medicine, because at the end of the day, you want to have your body heal itself as best as it can rather than confuse it with external pharmaceutical drugs. I hope you all found this helpful, but like I said in the beginning, for any medical advice related to yourself, seek attention from your own personal medical provider. All right, thanks for watching, and I will see you in the next video. Bye.